Hello everyone. So today we are going to talk about something important, and that is lipid lowering therapies and why the compliance to it is of paramount importance. So firstly we need to understand why do doctors prescribe lipid lowering therapies. So it is a proven fact and different scientific studies numerous have proven that the coronary artery disease, that is development of blockages inside your coronary arteries or heart arteries, happens due to high cholesterol levels. Although there are other factors, but this is a very important, a major factor and also a modifiable factor. So to reduce the risk of development of these stenosis, a doctor or physician prescribes you statins or lipid lowering therapy. Now, the problem is most of the patients stop this by their own. So there are two major reasons behind this. Firstly, cholesterol as such do not cause any symptoms. So patient feels if they are asymptomatic, why should we continue it? They don't realize the importance or the long-term benefit of this therapy. Secondly, many patients stop it due to some or other side effects. Instead of going to their doctors discussing about the side effects, whether that can be controlled or not, whether alternative therapies are available or not, they choose to stop it right away, which is a very wrong practice. Any treatment that has been prescribed to you, you should always make sure that you should not modify it by yourself without discussing with your physician. So this has become a common practice and which is very wrong. So the importance of compliance is that these cholesterol levels, if maintained below a particular threshold depending upon the individual risk profile, can lead to long-term benefit effects. Irregular therapies or therapies for a short term will not benefit you. Most of the times these therapies when taken for years helps you increase years in your life. So it should be mandated and kept in mind that lipid lowering therapy is an important drug in your treatment line, although you don't have any symptoms, but you might need it if your physician has suggested it. Another important thing is when should we be more concerned about starting or prevention. So basically, ideally you should be concerned throughout your life, but the age of 40 is something where your risk suddenly starts increasing and you should focus on prevention because prevention is always better than cure. Especially if you have hypertension or diabetes at the age of 40, even if you are asymptomatic and your other risk factors are well controlled, lipid lowering therapy is advisable to make sure that your LDL cholesterol or the bad cholesterol remains below a specific limit. I hope you found this small video useful. Thank you.